Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Epidural, and we are looking at the test dose which is given. So, the test dose is designed to detect both subarachnoid and the intravascular injection. So, it is used to detect the subarachnoid and also the intravascular injection. Intravascular injection. So, two things. And the classic test dose combines the local anesthesia and the epinephrine. So when you look at the classic test dose, so what is a classic test dose? So we talk about the classic test dose. It combines the local anesthetics and the epinephrine. So it combines the LA, that is a local anesthetic, and the epinephrine. So it typically involves 3 ml of 1.5 of the lidocaine. So this includes the typically 3 ml. So it involves 3 ml of 1.5% lidocaine. So 3 ml of 1.5% of the lidocaine, and this is with 1:2 lakh. So this is with 1:2 lakh of the epinephrine. So 1:2 lakh of the epinephrine, and here it is going to be 0.005 mg per ml. So the classic test dose, it combines the local anesthetic and the epinephrine, typically 3 ml of 1.5% lidocaine with the 1:200,000 epinephrine. So here the 45 ml of the lidocaine. So we talk about the 45 mg. So 45 mg of the lidocaine. So this 45 mg of the lidocaine, if given the intrathecally. So what is the case? So when it is given intrathecally, it will produce a spinal anesthesia that should be rapidly apparent. So what happens? This 45 mg lidocaine, when given intrathecally, it produces a spinal anesthesia. So it produces the spinal anesthesia. Next we move on to the 15 mcg dose of epinephrine. So when the 15 mcg dose of epinephrine, so when this dose is administered, if it is injected intravascular, so we are writing it as IV, it should produce a noticeable increase in the heart rate. So it will show an increase in the HR, that is the heart rate, and that will be 20%. So that will be 20% or more. So equal to or greater than 20%, and this will be with or without. So it will be with or without the hypertension. To learn and grow daily like this, please do subscribe.